Good morning and welcome to COVID-19 update on Silverbird Television Abuja. Now this program is brought to you by the Widows and Orphans Empowerment Organization with support from USAID Effective Water, Sanitation and Hygiene Services e-wash program. Now Nigeria has continued to record a surge in cases as the latest statistics provided by the Nigeria Center for Disease Control (NCDC) reveals that as at the 21st of December 2020, we have 356 new confirmed cases in Nigeria and 6 deaths so far recorded. And now till date, we now have 78,790 cases that have been confirmed. We have 68,483 cases discharged and 1,227 deaths that have been recorded in the 36 states of the Federation. The FCT has reported 79 cases. We have Lagos 59 cases, Kaduna 56 cases, Katsina 37 cases, Nasarawa 30, Kano 25, Edo 18, Gombe 14, Kebbi 12, Akwa Ibom 7, Rivers 7, Sokoto 7, Abia 3, Ogun 1, and Cross River State 1. Well, this program is aimed at preventing further spread of coronavirus by creating awareness on the importance of maintaining good hygiene practices and following the laid down COVID-19 health protocol to further stop the spread of the disease. Now, the surge of COVID-19 cases in Nigeria and the rise in the curve has necessitated the need to create more awareness to enlighten more people on the dangers of being infected, especially during this festive season. That is why the focus for today is on COVID-19 and the holiday celebration tips for gathering safety. If I didn't mention earlier, my name is Georgina Ndukwe Izainka, and our guests are Dr. Lawal Lukman Ademola. Dr. Lawal Lukman Ademola is an incident manager, FCT COVID-19 Emergency Operations Center. You're welcome.
Thank you.
We also have someone who will be joining us via telephone line, and that is Dr. Josephine Okechukwu. She is, will I say incidentally now, I don't know, but she is a COVID-19 survivor. She is a Director, Public Health Department, Health and Human Services Secretariat of the FCT administration. She has survived the coronavirus infection and she's currently recovering at home as she has left the isolation center at the moment. So we'll be having both of them talk with us on the program today. If you have questions or comments or observation, please do call us on the number 0810-583-0411. 0810-583-0411. We remember we are also live on YouTube at STV Abuja. We will be kicking off the program with the latest information coming from the Presidential Task Force on COVID-19. There was a briefing yesterday and certain rules or restrictions was put in place, especially as regards public places. And we'll get Dr. Lukman Ademola to bring us up to date with the latest. Before then, we will... Okay. All right. So we'll get Dr. Lukman. Please... let's get to hear from you what's happening as regards COVID-19 pandemic in Nigeria. And of course, what is the latest from the Presidential Task Force on COVID-19 as at yesterday?
Thank you very much. What is happening in the COVID-19 response is that we are having more cases. There's a surge in the number of cases that we are reporting for Nigeria in particular, Nigeria in general and FCT in particular. So the new thing, actually it's not new, because the last time a guideline was released in October, these were all these points that were just restated yesterday had been there. Bars were never allowed to open. Restaurants were supposed to only do either sit out or allow people to come in and buy food and then go. And even for social events, it has always been 50. That's been the guidelines since October. I think the last guideline came out in October 19th. That was the last signal came. The last guideline came out in around October 19th, and that was when all this was stated. I think the only new thing is that states are expected to take the lead in this response. So the PTF advised states to please take the lead and ensure that these are enforced using the legal instruments that the states have to ensure it. So what we are trying to move to now is to ensure that this policy, this guideline is enforced.
Okay. So how would we describe the infection rate in Nigeria? Should we call it a second wave or should we call it a surge?
I think for now the right terminology is a surge, but it's looking like a second wave. So, for example, in FCT, before now, I think we had our highest number of cases in the last week of July. As at that time, FCT recorded 576 cases in the last week of July. By the middle of October, when this guideline was released, when there was an ease of lockdown, FCT was recording about 53 cases per week in the middle of October. By the first week in November, for the first week of November, we recorded 109 cases. By ending of November, this had increased to 262 cases. In the first week of December, from 256 cases, which was recorded in the last week of November, this number had increased to 507 cases. Second week in December, we've moved on to 126 cases. And as at last week, the last week that ended on Sunday, we've recorded 123 cases for that week. So there's been an astronomical increase in the number of cases that we're recording in Nigeria in general and in FCT in particular.
So what would we say is responsible for this surge? Are we attributing it to people, the lackadaisical attitude of people regarding, practicing hygiene, maintaining distancing, and even wearing their face mask?
So it's multifactorial, but the key thing there is that people are not adhering to the non-pharmaceutical interventions. People, just like you stated, because most people have this low-risk perception about COVID. Some don't even believe that COVID exists, and so most people are not using face masks. Most people don't practice hand sanitizing. Most people under hygiene, which involves washing of hands with soap and water or use of hand sanitizers. Most people no longer maintain social distancing. So this is the key thing. Then there are some other activities too that have been contributory. We've eased lockdown. We've allowed international and local travels to take place. Schools were advised to open. Core members were mobilized to camp. So all these activities contribute. But the key thing is that people are not adhering to the non-pharmacological intervention, pharmaceutical intervention. Like in the FCT, from people that call in to our call center, we ask questions, and from a sample of about 1,500 people, it is only 7% of that number that says they wear face mask regularly. And we know that self-report is not a very good way of assessing things. So when only 7% are self-reporting that they use face mask frequently, that shows that there's a problem.
Well, with the rising cases of COVID-19, what's being done to ensure community spread is stemmed? Because it's going to be an issue. We are going into the festive period now. We'll get to see more people going to meet up with family members, visiting friends. I mean, you would say it's COVID-19, but you still have to mingle, so to speak. So how do we handle this?
So one thing I want us to realize is that we need to stay alive to enjoy this festive period. And there are going to be more festive periods to come. So for this particular festive period, we need to calm down. We need to avoid unnecessary travels, non-essential travels. The guideline has said this festive period we should avoid going to crowded areas. We should do it within our house. If we need to go out, if we need to have a gathering, it should be outdoors. I read somewhere where it says now it's an act of love not to visit your loved ones, because the aged people are more vulnerable. They are the ones that are likely to die from COVID-19. So this is a time in which we advise that they stay at home. We advise that we usually every December most of us travel home to spend the break with our parents, but this is not the best time to do that. Everybody should just stay where they are. But more importantly, we need to learn to use our face mask correctly and at all times.
What other recommendations will you give for, if there has to be a large gathering? Like, what is the recommended figure you mentioned earlier was 50 at least. What other recommendations would you give people who may have to gather 50 people? For instance, a burial that has already been fixed, and of course you would expect people to come in. Should they ensure that everyone wears face mask, or arrange water and soaps nearby and all that? So what are your recommendations?
So for a burial that has been fixed, one is that even at a point people were having it became a norm to have a virtual wedding. People were having weddings and they were sending us the Zoom link, and we all did not see anything. So even for the burials and all the activities that have been fixed for December, we can still go back to that. Like I said, we need to be alive to do these things. We need to be alive to be healthy, to participate in other, and there are other opportunities. If someone is getting married now, hopefully we are praying that in the next 9 months there will be a naming ceremony. That could, if things are okay, that could be another opportunity to visit. So the thing is, if as much as possible, we should try and avoid these gatherings. Even when we are invited, we should say no. We should stay at home. And if we have to go, even if it's within 50, the number that is prescribed, you need to, the organizers need to ensure that there is a space for hand washing, so everybody will wash their hands while they get there. They will use their face mask. One common thing with Nigerians is that when you are going in, you have your face, even at supermarkets and malls, at the gate you have your face mask on, and then when you enter,
you pull it down to the chin.
Pull it down to the chin. By the time you are leaving there, you have it in your pocket. So please, when we go out, we should always ensure, either for social events, even in our offices or anywhere, we should always ensure that we wear our face mask correctly.
You're watching COVID-19 update on Silverbird Television. Today we are discussing COVID-19, the holiday celebration, and tips for gathering safely. Our guests are Dr. Lawal Lukman Ademola, Incident Manager, FCT COVID-19 Emergency Operations Center, and of course, as I mentioned earlier, we'll be having Dr. Josephine Okechukwu join us via telephone line, a COVID-19 survivor. She's also the Director, Public Health Department, Health and Human Services Secretariat, FCT Administration. Like I mentioned earlier, you can be a part of the conversation. We are live on YouTube at STV Abuja. We will be joining our second guest in a bit. Okay, so let's just go on a short break, and then by the time we get back, we'll be speaking with Dr. Josephine Okechukwu. All right, it's COVID-19 update on Silverbird Television. Thank you so much for staying tuned to the program. I am Georgina Ndukwezainka, and we'll be having our second guest join us via telephone line. She's just been discharged from an isolation center, so we can rightly describe her as a COVID-19 survivor. Her name is Dr. Josephine Okechukwu, Director, Public Health Department, Health and Human Services Secretariat, FCT Administration. Good morning, ma'am, and welcome to the show.
Yes. Hello, good morning.
Good morning, and welcome to the show.
Thank you very much. Good morning to you.
It's great to hear your voice. It's great to have you join us.
Oh, it's my pleasure too.
Awesome.
Thank you for having me.
Okay, so let's just start off first of all by having you share your experience as a COVID-19 survivor. How was it for you?
Yes, thank you for that as a COVID-19 survivor, I had my experiences. They were not too good. We all know what COVID is all about. I was sick. I came down with the symptoms, but within 24 hours, the symptoms got so bad. I was rushed to the hospital after the results came out to be positive. At the hospital, I was well taken care of. The treatment center was very good. The staff and the management rallied around me and gave me the care that I needed. But the complications were not bad because I never came down with complications anyway. I had fever, cough, body pains, severe headache, and catarrh, which were properly managed. At the end of the day, what I know is that my own was diagnosed very early, and the treatment was instituted very early, which abated the complication that I would have developed. But that notwithstanding, the side effect I'm having now from COVID, I'm still having that terrible cough and occasional difficulty in breathing, though I wasn't on oxygen, but I'm doing well.
Okay, that's great to hear that to an extent you've gotten some relief. I'm sure with time your symptoms would go. Now,
Yes.
with poor adherence to COVID-19 prevention guidelines has actually remained a major concern, and the super spread areas also contribute to this surge. What is being done by the FCT administration on public health department in this regard?
With the advent of this second wave, we are doing so many things. When we look at it, we still have this group of people that still do not believe that COVID-19 is true. So many of them still have their myths and misconceptions about COVID-19. So we are doing a lot of communication, sensitizing the community about the COVID-19. The reality should come to them that this is real, and then they should maintain the preventive measures which have been stipulated by NCDC and the federal government. So we are doing a lot of communication and community engagement. We are engaging the communities, the stakeholders in the communities, the religious leaders, the market women, everybody on board is being taken care of in terms of engagement. And we are going to the communities to go and sensitize them. We have to storm the marketplaces, the religious houses, and every other place to make sure that everybody gets to know about our current situation as regards to COVID-19. And when we look at it, this is a very bad infection, so there is need to do testing, to test a lot of people. So we are ramping up our testing, creating more service delivery sites where people can have access to testing. So we want to go around the area councils to provide testing sites at each local government so that people will have access to testing. And we are procuring a lot of commodity to ensure that testing is being done as appropriate. And for enforcement, the federal government, through the Minister of FCT, is instituting enforcement. Because when we look at it, if people do not adhere to the preventive measures, there is little that we can achieve. So there must be enforcement for people to make sure that they wear their face mask, maintain this physical distancing we are talking about, and then contain and control this infection through social medium. And people working should know what to do. There is just a guideline that was now released to make sure that people work from home. The directive has been given by the federal government that anybody on level 12 and below should stop going to work. So as to make sure that there will be no clustering or overcrowding in workplaces. And then the transportation, this is festive period. this is festive period, the transport industries, both road and air and any means of transport, should abide by the reduction and then maintenance of the preventive measures that is being advocated. So we need to look at the FCT partly or is putting so many measures on ground to make sure that this COVID-19 transmission is reduced at all costs.
Are there any challenges being faced by the campaign team or the FCT administration in ensuring both enforcement and adherence to protocol, the health laid down protocols? Are there any challenges being faced?
Yes, of course. Naturally, you expect some resistance by some group of people where you are trying to enforce such measures. The main concern that we're having now are the asymptomatic patients that go spreading this disease. Many people are not coming up to come and do testing. So, and when you look at it, majority of them too will be positive. So if they are not being tested and they don't know their status, they will keep on spreading the disease. So we need to go ahead to make sure that all those people are sorted out so that to curtail the transmission. And the myth and misconception of people about this is a challenge. If people do not believe that COVID-19 is real, they pose a big risk to the community and to the society in general. And people are not wearing their face masks despite the communication we've been having. Many activities are ongoing, wedding, they are going to church. Even in the church, you notice that they will carry their face masks and show at the gate of the entrance of the church. But when they get in there, they don't wear it. They put it in their bags or pockets or sag it. So the proper wearing of these face masks is a huge challenge. With this enforcement, people are going about with the face mask, but they are not wearing it. And some of them are not even bothered about it, and they are still creating problem for us. So our people mindset, the attitude is a huge challenge. So there must be some level of attitudinal change for us to achieve the success we are looking for in control of this COVID-19 spread.
Okay, ma'am.
And our communities too. The communities, some of them are hard to reach. Many communities are hard to reach. So even the message getting to them is a problem. We sensitize the community stakeholders and we expect them to go back home to transmit this information to their people. Some of them don't do it. So there is still a huge number of people out there, they are not aware of COVID-19 and its complications. So these are the challenges we are having. And many people that are diagnosed too have refused treatment. They are refusing treatment.
Why?
This attitude of, yes, some of them, when they do the test and their result comes out and they are positive, when you communicate these results to them, they tell you it's not their portion, it's not their result, they cannot be positive, despite the fact that we are trying to see what we can do to halt the transmission of this disease. So many of them have refused to believe their results, and they have refused to take treatment for COVID-19. Even we are treating people at home now. We are doing the home-based care, treating people at home. The majority of them refuse to take their drugs. So these are source of transmission to the community. So we really need to change our attitude and change our behavior towards COVID-19 infection.
Okay, I would want to now ask, the issue of assessing treatment or even placement in the isolation centers. Some persons have said it is man no man. Like if you don't know someone at the top, you might not have access or you might not be attended to immediately. Is that the situation?
That is not true. It is not correct. That is absolutely wrong. I would want to see one or two people that have had challenge getting into the treatment center. Our main challenge is people even accepting to go to treatment center. We communicate their results with them. We come up with ambulances to take them to treatment center. Many of them refuse. So nobody has been denied access to any treatment center in FCT. No way. If you have any such person, please let me know.
Okay. All right.
Yes, thank you.
Okay. I'll come back to Dr. Lawal regarding the new strain of the virus. that was just recorded in the UK in Nigeria. But there are talks about the COVID-19 vaccines. Do you have any concerns? Because I understand the National Assembly, have had meetings with the PTF and the Minister of Health and NAFDAC regarding purchasing the COVID-19 vaccines. Do you have any concerns regarding that, and what do you know?
19 vaccine now is that with what we have, we know that in other countries they are facing their third and fourth wave, and the mortality is increasing every day. The earlier we get this vaccine for our country, the better for us. We don't have to wait to get through the second wave, third wave, when we face so much crisis and so much challenge and mortality before we start taking decision. The time to take that decision and make move is now to get vaccine for Nigeria. With so many people are talking or saying so many funny things about this vaccine. I don't think that is right. I don't think it's true. It's just to frustrate the system. I don't think that we allow our people to die, keep on dying from this COVID-19 infection. If we have ways of saving lives through this vaccination, that would be a very beautiful breakthrough. So Nigerian government should work hard to make sure that they provide this vaccine as soon as possible to its populace. Without vaccine, it will be difficult now to control this disease.
Okay. Thank you so much, Dr. Josephine Okechukwu. Really appreciate your contributions on the program. Let me come back to Dr. Lawan Ademola. Now, we heard in the news the new strain of the virus in the UK, mutation, and possibly one or two cases in Nigeria. I'm not too sure, so you just clarify on that if we have that here in Nigeria as well, and then we'll get your candid advice on preventing the spread of COVID-19 before we wrap up.
Okay, so all viruses have the ability to mutate, to change their genetic form. Sometimes they change to forms in which becomes unstable and lead to them dying, or sometimes they mutate to forms in which they become more stronger and ability to. So this particular strain now that UK is reporting, they found out that it has the ability to infect is higher. That means that if one person has it, the chances that the next person is going to spread to other people is higher than the former strains. But there is no evidence that the severity of the illness is much more than what we currently have, which is kind of like a good news. But the challenge is that if more people continue having this disease, then there is likely that more people will have the severe form of it and more people are likely going to die. So it's still bad news. In Nigeria, being coordinated by the Nigerian Center for Disease Control, they are watching, surveillance is on. Even before now, there's a system in place to check for the genotypes of the circulating virus. And currently now there is no information yet that we already have this strain in Nigeria, or it's adding to, it's part of the reason why we're having this increasing surge.
Okay. All right, so just give us your last words, candid advice to everyone on preventing the spread of COVID-19 as they celebrate the festive season.
So the most important thing for Nigerians is to believe that COVID-19 is real. It's in Nigeria, it is spreading, and so many people are having it. And though most of those that are having it, about 70%, don't have symptoms or they have mild symptoms, there are still a large number of people that are elderly, people that have comorbidities, hypertension, diabetes, cancers, that are having the severe form of this disease, and people are dying. So please, we need to believe that there's COVID. And currently now, the only thing that we know that works to prevent the disease from moving from Mr. A to Mr. B is if we practice respiratory hygiene, always wear our face mask correctly and at all times, wash our hands as often as possible. If we don't have soap and water nearby, we should have hand sanitizers to do that. We should try and avoid finding ourselves in confined spaces with other people. We should practice physical distancing. So these are the key things that can help us through this pandemic.
And like you said, it's now a love act to not to visit your loved ones this season. So if you can help it, please try as much as possible to stay away from traveling this festive season. Of course, if you leave through the festive season, you will leave to see another Christmas and New Year celebration, isn't it? Okay, so ensure you wash your hands like Dr. Ademola has said. Wash your hands with soap and water for up to 20 seconds. Avoid touching your nose, eyes and mouth. Maintain physical distancing and avoid crowded places. Take responsibility to stop the spread of COVID-19. Our guest has been Dr. Lawal Lukman Ademola, Incident Manager, FCT COVID-19 Emergency Operations Center. Thank you so much for coming on the program. Really appreciate you. And you also heard from Dr. Josephine Okechukwu, COVID-19 survivor and also Director, Public Health Department, Health and Human Services Secretariat, FCT Administration, that we spoke to her live online, rather via telephone. Okay, so I am Georgina Ndukwezanka. Thank you so much for being a part of the program. Really appreciate you watching, tuning in. This program is brought to you by the Widows and Orphans Empowerment Organization with support from USAID, Effective Water Sanitation and Hygiene Services eWash program. I would say for you to stay safe as you celebrate this festive period. We want to be able to see 2021. So please ensure you observe the laid down health protocols. Stay safe, Happy New Year and a Merry Christmas.